The idea of altering your face is possible with plastic surgery, but a lot of people don't realize how easy it is to change your face. Facial plastic surgery includes facelifts, laser treatments around the eyes, rhinoplasty, which is a nose job, and chin increase or reduction surgery. Beginning tonight, we're following a patient through plastic surgery. I know the patient pretty well. She's my younger sister. This evening in the series, My Sister's Surgery, a cosmetic change, get to know Shannon Mercer as she prepares to undergo an operation that fulfills a long-time desire. She has everything going for her. 27-year-old Shannon Mercer is healthy, athletic, and ambitious. Running is her favorite form of exercise, a good way to relieve stress from a hectic job of full-time Christian work, a career that moved her from USC to a university in Tennessee. Now she's ready to make another move in her life.
That's good. Now turn away from me just a little bit, Shannon. Too much. Come back a little right there.
That's why she's in the office of Dr. Smythe Rich. Dr. Rich is a facial plastic surgeon here in Columbia. And with the help of his computer, Shannon is able to see what she will look like after plastic surgery on her chin and nose. In this shot, you can see well the lower third of Shannon's face is not as strong as her eyes and cheekbones. Her chin drops off. With a chin augmentation, or increasing the size of the chin using an implant, Dr. Rich can make a weak feature stronger.
Show me with your finger. Take your finger and touch this screen right here and tell me what you would change.
And a prominent feature, her nose, will be made softer with rhinoplasty, or a nose job. Shannon points to what she considers too broad of a nose, a trait others made fun of when younger.
Kids can be mean, and I think it was something that they always, made fun of.
What would they say?
There comes the girl with the big nose, or, did you ever know your nose was big, or...
Hearing that, she became self-conscious.
I never liked seeing the pictures of my profile. In pictures, a lot of times, I look at them. If I can position myself just right in a picture, I don't notice it as much.
Shannon looks at plastic surgery the way she does when a person has crooked teeth. You get braces. And if you don't like your hairstyle, you cut it.
The angle the nose makes with the upper lip's about 100 degrees, and we might give a little more of an upper rotation and lose a little projection.
I mean, kind of what I'm thinking, it's one of those things you always want done, and that's exactly the change that I want. And I look at it, it's like, that's it.
However, Shannon is quick to add she's happy with herself just as created. But because rhinoplasty and chin augmentation are so accessible, this operation is an opportunity worth taking.
I don't think you can go in it thinking, oh, this will change my life, this will change my self-image. I think you have to be confident in who you are, but just like I had braces to straighten my teeth, I'm going to have my nose a little smaller.
See, there's a subtle change. This is still Shannon Mercer, but I think that these features harmonize with your face a little more like what you had asked me.
Preoperative photographs are taken to help the surgeon plan the operation. These will be used as the before and after record of the results. Dr. Rich says different surgeons will create different images, but what matters most is that the patient and doctor agree. That's why he puts a priority on this computer consultation before surgery, so the patient is assured of what's ahead. Nose and chin surgeries are performed in hospitals, but can also be done right in the doctor's office if he is set up with a surgery center, and that's the case with Dr. Rich's office. The operation is almost always done on an outpatient basis. In tomorrow night's My Sister's Surgery, we'll take you inside the operating room as Shannon undergoes a chin implant. Thank you, Joe. And now we go into the operating room for a very interesting look at plastic surgery. Yesterday we told you about my sister Shannon deciding to go through with a long-time desire. She wants to have her nose reduced in size and a chin implant put in to build up what is a weak area on her face. As is the case with any surgery, parts of the video are graphic.
Shannon was willing to let us follow her through this procedure. Now, this way we can all learn what's involved in cosmetic surgery, what goes through a patient's mind while a very key part of her body is about to change. Here is My Sister's Surgery, a cosmetic change.
We have an eraser, and it's always best to erase things here.
After a lengthy computer consultation with his patient, Dr. Smythe Rich and my sister, Shannon Mercer, are satisfied with the cosmetic game plan, a plan to build up a weak chin and decrease the size of her nose. This will improve the proportion of her facial features. A few days later, Shannon is back in the plastic surgeon's office preparing for her surgery. No hospital gowns here. Shannon is able to stay dressed comfortably in casual clothes. She washes her face to remove all traces of makeup. By doctor's orders, she has taken 2 Valium an hour before the scheduled surgery. Shannon's obviously feeling good enough to wipe dry the mirror, chrome, and sink. I think I'm more nervous than she is. But as we always do as sisters and best friends, there's plenty of joking between the two of us. Rather than lie on an operating table, Shannon is placed in an operating chair.
One of the first things I'll need to do is to start an IV in your arm.
The anesthesiologist gets an IV started and injects drugs to put Shannon to sleep. Pre-op pictures are kept in the surgery room in the surgeon's view. Shannon is strapped in, while Dr. Rich scrubs up. Being sterile is a priority to avoid infection when putting in the implant. Her eyes are still opening, but she's getting progressively sedated.
I'm going to make some little marks. Shannon, how you doing? Okay.
This is a nerve-wracking time for me. This just isn't any patient. It's my younger sister. Dr. Rich begins cutting the chin, then cauterizes the skin. This tool burns the area, sealing the skin to keep blood from running. Using a high-intensity headlight, Dr. Rich then creates a pocket for the implant. A sizer is used to determine what size implant to put in. The actual implant is made of a material called silastic.
Just been used for over 20, 30 years without any problem or question. Some artificial knees and hips are made out of, and some pacemakers. It's quite safe. It's completely permanent, but completely reversible. It doesn't really have a lot of ingrowth, but it's securely fixed to the jaw, so it doesn't move. So afterwards, it feels very much like your natural chin.
The chin eventually will form a capsule around the implant.
Seems to be right on the roll of the jawbone.
The implant is inert, meaning it will stay in the position planted. Now inserted, Dr. Rich begins sewing up the chin.
These stitches will come out in just 5 days.
On average, putting in a chin implant takes less than an hour. Not long to make a once weak feature stronger.
The body does not react negatively to the material used in the chin implant. The piece is firmly adherent to the bone, the skin will move, the implant won't. So it feels very similar to the natural chin. Generally, operations inside doctors' offices are less expensive than if done inside the hospital. The cost of a chin augmentation, or increasing the size of the chin, will range from $1,500 to $2,500. Tomorrow, in My Sister's Surgery, Dr. Rich will give Shannon a smaller nose.
It's very fascinating, Dawn.
It is.
It really is.
And I just want viewers to know, because a lot of people see this and think, oh, she's got to be in a lot of pain. Shannon says she had some discomfort for the first week and a half, but she would never have labeled it pain. And you watch the way Dr. Rich was moving on her, she's doing great.
That is. I've seen her, and she is doing great.
Well, think about this. Studies show that approximately 80% of the population does not like some feature on their face. Well, there's one particular area that more people want to alter than any other. You know what it is? It's the nose. Rhinoplasty is the #1 requested procedure in the United States. My younger sister Shannon is one of those who decided to do something about hers. She also had a chin that dropped off, and yesterday we watched her surgeon put in a chin implant. Well, this evening we witnessed the second half of her cosmetic operation. Now, listen to this. Keep in mind this is surgery, and so some video is graphic. However, it's not often we get to see what such an operation is like. As sisters and best friends, I watched her undergo a change she has wanted for a long time. At the age of 27, she decided it was time to do it. Have her doctor create a smaller nose. Here's part 3 of My Sister's Surgery, a Cosmetic Change.
As part of pre-op procedures, Dr. Smythe Rich put strips with a measured amount of medical cocaine inside Shannon's nostrils. The strip numbed the nose. To reduce the size of a nose, the Columbia plastic surgeon begins by cutting out cartilage. He suctions out excess blood, keeping the area clean, so he can clearly see where he's working. Dr. Rich is literally sculpting the tip of the nose.
There's thin cartilage in the nose that forms the facets of the little small places that reflect light. And by removing cartilage in certain key areas, well, we maintain the integrity and shape of the nose, but we narrow it.
Dr. Rich does about 2 rhinoplasty surgeries a week. He's been doing them for about 10 years.
Just by removing cartilage in this area here, it lets the sidewalls come in.
The nose is an easy part of the face to change, but caution must be exercised.
It's always best to do a little at a time. You can always take more away, but it's much harder to put back.
One thing making Shannon's surgery tough is the thick skin on the tip of the nose. Now begins the filing down process.
On the bridge, we'll just make it a little lower, just like we did on the imager.
The imager to which Dr. Rich is referring is the computer consultation done before surgery. This is a communication device that enables the patient and doctor to decide what the finished product will be. Dr. Rich continues to file down the bridge. At this point, the nose is beginning to swell.
So I keep referring back to my photographs so that we don't overshoot or work on something that is not there. The last move I'm going to make is to narrow the bones here.
By this point, feeling a little queasy, I've already left the operating room a few times. Dr. Rich knows it's time to throw in a little humor.
We're just looking for the stud.
The hammering process has an important purpose.
We've lowered the bone of the bridge by filing it down, and now we've made little tiny bony cuts such that when we put a little pressure, the nose will infracture and narrow.
It was at this point I had to remind myself, just like in life, sometimes we have to be broken to be better. That was the case with Shannon's nose.
Cut them at the bottom, cut them in the middle, and it left right there, and that just snapped. What Vicky's doing now is holding a little pressure so that the bleeding from the cut bone doesn't run underneath the eyes. These are some of the finer techniques that we're able to do to limit the big raccoon eyes.
With the rhinoplasty surgery complete, Dr. Rich and his operating team put on a dressing, a cast. It will keep the nose in its new position. Throughout this nose operation, which lasted under 2 hours, Dr. Rich assured me, despite all the tugging and filing on the nose, and even breaking of the bones inside, Shannon will not lose any function. She'll only gain a look she's wanting.
And that isn't the look quite yet, but Shannon will wear the cast for 6 days. For a while, she would feel stuffy, like she has a cold. And if you think cosmetic surgery like rhinoplasty is something for the rich and famous out in Hollywood, Dr. Smythe Rich says it is not. He performs the surgeries on people from all different walks of life. The average cost of a rhinoplasty surgery ranges from $2,400 to $5,000. Tomorrow, in My Sister's Surgery, I'll show you how she looks.
And we were all wondering, has Shannon seen the pictures of herself going through that surgery?
She has not yet.
She may not be ready for that.
No, but thankfully, since bruises and everything are gone and she looks great today, I think she can watch it.
Okay.
You're watching WIS, live at 5.
Well, it is Time now to see what my sister looks like after plastic surgery. It's been a little more than 6 weeks ago. And as the facial plastic surgeon said, to draw a face like Michelangelo would, he would draw a line down from the face, through the forehead, through the lips to the chin. But Shannon's face did not make that line. Although very content with the way she was created, Shannon decided to take a leap of faith and have plastic surgery. She knew it would be a chance to make the features on her face more balanced. Here's the conclusion of My Sister's Surgery, a Cosmetic Change.
Dr. Smythe Rich, a facial plastic surgeon in Columbia, put a chin implant in my sister, Shannon Mercer. He also made Shannon's somewhat broad nose smaller. In his surgeries, Dr. Rich goes on the conservative side, rather than make drastic changes. But for Shannon, it's an important change, because the weak chin and protruding nose have been such big concerns since she was a kid, and other children sometimes made fun of that nose. After the surgery, Dr. Rich bandaged Shannon up to help keep the changes in place. Then I tried talking to her.
You know who it is, Sissy? Who am I?
Obviously still drugged, I told my sister that Dr. Rich put her nose above her eyes. She responded with, good.
We're going to use a little of this solution that helps to melt the adhesive a little and help it slide off easily. If only our mothers had this for those Band-Aids.
6 days after surgery, Dr. Rich removed Shannon's bandages on the chin. Naturally, there's a moderate amount of swelling and bruising. It will go away in the following weeks.
The chin's a little bigger than it's going to be due to the swelling, and that will deprevess over the next few months. Most of it will be gone within a few weeks.
Then he removes the nose cast. The nose is smaller. The tip of it is turned up a little bit, but will later rotate down.
I like it.
Yeah.
Dr. Rich puts on some fresh tape to be worn a couple days.
Just that second day was the hardest day when your eyes were swollen. You can't breathe, but
Kind of like a bad cold?
Exactly.
And today, Shannon is pleased and proud of the subtle but significant new look. Here are the before and after pictures. On the left, Shannon's chin drops off. Her nose protrudes out. The picture on the right, after surgery, Shannon's chin is made stronger, her nose size reduced. The face is more balanced.
People that didn't know that I had it done, I hear comments like, your teeth look whiter, your eyes look bluer, and they pinpoint everything else on my face except my nose or my chin.
Shannon wants people to remember the surgery changes a person's features, not his or her life.
No, it didn't change you as a person. It didn't change your problems or your good times or anything like that. It doesn't change who you are. Things don't become better in your life. It's just, you know, it's just like you go out and get a new haircut. You wear braces to straighten your teeth. It doesn't change who you are as a person, I don't think.